This is going to be a review of CAD and myocardial ischemia for the physical therapist. So what is CAD, or coronary artery disease? Well, we think about the artery, and we have the artery right there, and we have the lumen and the smooth muscle of the artery there. What happens with CAD? There's something that takes place that causes a narrowing of that blood vessel. So typically it might be a buildup of plaque that takes place that ends up blocking that blood vessel. It can be vasoconstriction takes place, so the smooth muscle constricts for whatever reason, causing narrowing the vessel, and then also, again, plaque building up can cause those things there. And we typically think about this happening in the coronary arteries, but it can happen anywhere in the body. The atherosclerotic process, that's that building up of the arterial wall through smooth muscle cells, necrotic debris, etc., as you see on there. Partly lifestyle, partly genetics. Different stages that we go through. Stage 1, damage. So we think about, again, the vessel itself, the endothelium, becomes a little damaged. So we may have just a little damage right there, and what happens is that builds up, starts this process of damaging happening. In stage 2, we'll have the vessel again. Let's draw that a little bit differently. Let's kind of look at it this way. If we had the vessel like so, kind of a longitudinal view of things, you might start to have some fatty streaks that build up. So fat kind of starting in the vessel itself. We have an inflammatory process going on, narrowing the vessels, and this process is beginning. Typically asymptomatic at this point. Again, stage 3, you have that plaque continues to grow, you have those fatty streaks, and then on top of that you might be getting some of the plaques that tend to kind of come up, and you get narrowing of the vessel, and that could be happening at different places all throughout the vessel, causing problems as the blood goes down the vessel. So that narrowing takes place. Might start to have some symptoms at this point, depending on how much narrowing take place. And then we get over here to stage 4. And during stage 4, what happens is you have that, let's say you have a big piece of plaque right there, and what might happen is that might crack open. There might be some sort of damage to it where it crack open. And now what happens, we get platelets that come up and they attack this area, and trying to prevent that. And you have inflammation that takes place. And then you have clots that form. Now all of a sudden you can't get, the blood stops right here, and then there's no blood on this side, and this is when we have an MI. So you see the process that might take place with a complicated lesion leading to a myocardial infarction. What is coronary artery disease? A mismatch of supply and demand. So the demand is high because of exercise, activity, any kind of metabolic activity that causes oxygen needs to go up, and supply might be low because of constriction in the vessel, cardiac output, Q or cardiac output. It could be the problems with the heart not pumping efficiently, leads to that mismatch, and we develop ischemia. So how bad the CAD is based on a variety of issues, but the key of it, the severity and the length of exposure, determines what the impact might be. And you see all the things it can lead to, from death, decreased quality of life, increased costs, etc. Symptoms that you might have with CAD, typically you do not have chest pain until the blockage is about 70%. So you have a lot of leeway. A lot of things can take place before the person might experience chest pain. Dyspnea, having that shortness of breath with activity, especially fatigue, being very tired. Low activity levels. The person may not be very active, and that contributed to the development. And then after the development, because of angina and fatigue and dyspnea, they're not very active. Key thing for us as physical therapists is it'll eventually lead to limitations, inability to do activities. So some of the results, ischemia is one of them, myocardial infarction, heart failure, sudden death, and we'll talk about all those things here. But how is CAD managed? The 3 guidelines that just came out in 2013 addressed cholesterol, lifestyle management, and obesity. And we'll skim through most of it, but this is the Heart Association and Stroke Association guidelines, and the key with these is they're much more personalized. So what you see is missing is the threshold where you have to get to this number or that number. It's much more focused on individualized care. So number one, you start with the assessment of all your risk factors. So this is you should see blood pressure, age, gender, race, looking at your heart, looking at your brain, looking at what's going on. Discussion, we sometimes forget about the importance of that, just having that discussion with the doctor and talking about what's going on. And then from there are personalized plans. The 4 areas that you're typically looking at is one, assessment of risk. There's some really nice calculators out there which can really make the point that you need to make lifestyle adjustments to show you your risk. Obesity, point out it says a team approach, and that's where a PT might come in from the team approach. We have cholesterol, so managing cholesterol. That's typically done through the statins, is how that's typically done with medication. Also, of course, lifestyle modification. But you see the bad cholesterol number is not the guiding factor. There's something about the statins beyond the LDL levels that have some benefit. And then lifestyle. So not a big surprise. Exercise, eat right, reduce sodium. I would say stress management would also be put on there, sleep, things like that. One of the things this can lead to, as we talked about, is ischemia or angina. Angina is temporary. Okay, so angina will go away when the person rests. It's going to be, if you think about the person, the classic signs you might think about for a person who has an MI, we think about down the left arm. Typically might see it into the jaw, something like that. So that's typically where you might see those symptoms here. But it can also be in the chest itself. If we were to turn this person around, it can be in the back, between the shoulder blades. But the key thing with angina and ischemia is that it goes away with rest. Patterns I just mentioned about where it might be located. So we think about the arm, jaw, back, usually a sensation of heaviness, tightness, pain, all the symptoms like that are typical of ischemia. 3 different types of angina. Chronic angina means it comes on at the same time consistently. So this is the patient, every time they climb the stairs, they get chest pain after the 3rd flight. Unstable is going to be the person, it comes on at random times without even a pattern at all. Okay, so it could be at rest, it could be during activity, but different types of activity. The Prinzmetal angina, this is vasoconstriction. So the vessels go into a spasm, causing the angina. It can be the person has no blockage or nothing. It can be seen on an angiogram. It's the actual vasoconstriction that causes the ischemia and the anginal symptoms. And the differential diagnosis comes in, because as you learned in the pulmonary section, you can have pulmonary disease and chest pain. As you learned in musculoskeletal, you can have musculoskeletal conditions that cause chest pain. How do they determine it? Subjective examination, asking good questions. What brings it on? What relieves it? Does it hurt during certain activities? And then on the EKG, if the person is experiencing angina right at the time that you're with them or on the EKG, the hallmark sign is the ST segment depression. So we think of the P wave, QRS, T. That should normally be nice and flat there. But for this patient who's having angina, what you see is this depression right here, ST segment depression. Treatment, nitroglycerin can decrease the load that the heart is pumped, vasodilators, beta blockers. All these things are beneficial for treating angina, and I put this equation on here. The myocardial demand, or the double product, rate pressure product, is systolic pressure times heart rate. So anything you can do to lower systolic blood pressure, lower heart rate, is going to lead to a decreased demand on the heart and a decreased mismatch of oxygen supply and demand. So that wraps up CAD and ischemia. Hopefully that gives you a better picture of these conditions and how they relate to the practice of physical therapy.